Brace yourself. A child in San Francisco was infected with highly pathogenic avian influenza A, H5N1. But shockingly, no one can figure out how. This single case raises big questions about how this dangerous flu virus is circulating and whether we're prepared to spot it when it emerges where we least expect it. But here's the twist. Despite thorough investigations, health experts found no source or clear path of exposure, fueling both alarm and debate among professionals and the public alike. Background: until recently, California had recorded 37 human cases of highly pathogenic avian influenza, HPAI, H5N1, but none in San Francisco. Most of these were connected to an outbreak in dairy cows that first made headlines in Texas in March 2024, and which then spread to California. What makes this case so worrying? On January 9, 2025, during routine enhanced flu surveillance, a previously healthy school-age child in San Francisco tested positive for HPAI, H5N1. The child had only mild symptoms, including fever, muscle pains, stomachache, and eye redness, but thankfully recovered after a week. No one in the family or close to the child had similar symptoms or tested positive. There was simply no obvious exposure, no travel, no contact with farm animals, and no evidence of the virus in the child's school or home environment. This is the part most people miss. The case seemed to come out of nowhere. Diving into the investigation, upon the positive test result, the San Francisco Department of Public Health, SFDPH, sprang into action. First, they spoke to the family by phone, conducted a detailed medical review, and, within a day, visited the home for an environmental check, took swabs from all household members, and asked about any risk factors or animal contacts. All these steps were aimed at uncovering any possible sources of infection. Contact tracing was extensive. Authorities defined close contacts as anyone who had spent significant time within 6 feet of the patient without the recommended personal protective gear. This included all household members, classmates, and healthcare staff who'd seen the child while the test was positive. In total, 84 people were identified, with 67 meeting the criteria for close contact. Let's break down the testing. 7 household contacts and 4 symptomatic schoolmates were swabbed. None were positive for influenza. 9 close contacts, including adult family members, school, and healthcare staff, underwent blood testing for H5N1 antibodies. Unlike the child, none had evidence of prior infection. So where did the infection come from? That's the million-dollar question, and it remains unresolved. The family owns a dog, but no pets were sick. Although the family had purchased and eaten chicken from a live bird market about 2 weeks before the child's illness, the child did not go to the market, did not handle raw poultry, and the market's own flu testing turned up nothing. Digging deeper, the child's virus was analyzed using genetic sequencing. The results matched the genotype found in the 2024 to 2025 California dairy cow outbreak, but the family had no links to dairy cattle or those environments. Interestingly, San Francisco, despite not hosting any dairy processing plants, is on a major migratory bird route, and avian influenza had been detected locally in birds and even wastewater. Could environmental exposure, simply being outdoors, be enough? Or are there routes of infection we're not yet aware of? One controversial point: some believe this signals undetected community spread or environmental contamination, but official contact tracing and testing found zero evidence of human-to-human transmission. The child's classmates and family all tested negative, both by nasal swabs and blood tests. Key lessons and public health implications. This unusual case underlines the necessity of robust flu surveillance that looks beyond the most obvious risk groups or exposure histories. By randomly testing samples from a variety of people, including those with no traditional risk factors, public health systems increase their odds of catching hidden cases before they spread. And while most H5N1 cases in the U.S. have been mild, the situation elsewhere and the possibility of future mutations remains a global concern. Despite exhaustive investigation, there were limitations. Due to delays in identifying the case, the specimen was tested in batches. The main investigation started after the patient was already recovered, so some real-time opportunities were lost. Additionally, not every close contact could be fully screened due to logistical constraints, meaning a hidden asymptomatic infection can't be entirely ruled out. Broader questions and challenges. This case is particularly alarming, not just because of its mysterious origin, but also because it hints at unknown or poorly understood modes of virus movement. With H5N1 found in birds, cows, and even cats, the virus is capable of infecting many species. Is it possible the child contracted the virus from the environment or from surfaces contaminated by wild birds? What other hidden reservoirs might exist? So, what do you think? Should public health agencies be expanding flu surveillance, potentially testing people even when they have no clear risk for H5N1 exposure? Could the virus be spreading silently in urban environments? Is our current surveillance net really tight enough? Share your thoughts and debate in the comments below. Are we overreacting to rare cases with unknown transmission? Or underestimating a novel threat just waiting to take hold? One thing is clear. Ongoing enhanced surveillance and cross-sector collaboration using a One Health approach, bringing together human, animal, and environmental health experts, will be critical to track and contain this ever-adapting virus moving forward.